Good morning, ladies and gentlemen, and welcome to the 6th day of January 2021. Well, here we are. We had thought that this coronavirus would have been gone by now, and in 2020 would all be starting new fresh. Well, we are not with the new fresh, but we are in the new normal. Yes. So this is the sign of times to come. And this is what will need to be expected. So before we go into the main news for today, here's the headlines, and let's take a look at what's making news today. Well, COVID-19 updates. Let's take a look. Very soon we might be joining the Prime Minister as he goes live, or after we get the notification that he is live, we will join in. So COVID-19 updates. The Prime Minister Scott Morrison says National Cabinet agreed to the rapid antigen test kits should not be free for everyone. So, there's mixed messages going out there. People are saying it should be free, but he said that it will be provided at testing centers, which should take some pressure off the pathology labs, but there was no agreement in National Cabinet about free rates for everyone. So National Cabinet agreed to change in testing requirements in the aim of easing the heavy demand on testing centers and laboratories across much of the country. So despite this, COVID testing delays are expected to continue for weeks in Australia, with encounters of rapid antigen tests known as a disaster, what people are saying. The Prime Minister says Novak Djokovic must meet the border requirements to enter Australia, despite being given an exemption to play at the Australian Open by the Victorian government and Tennis Australia. Premier Dominic Perrottet admits that New South Wales health system is under substantial pressure as the state records more than 35,000 new COVID cases. Well, let's take a very quick look at what the facts and figures are. Here's some of the quick rundown. So today's COVID figures from around the country. So if we go around and let's take a look, New South Wales has recorded 35,054 new cases and 8 deaths. Victoria recorded 17,636 new cases and 11 deaths. Queensland recorded 6,781 new cases. South Australia recorded 3,493 new cases. Tasmania recorded 867 new cases, ICT recorded 810, NT recorded 117, and Western Australia 16 new cases, 5 of them were locally acquired. So National Cabinet met to discuss the responses of COVID-19 at the Omicron variant, new approaches to the test, trace isolation and quarantine, including the use of rapid antigen test, and the vaccine rollout and the booster programs. The Chief Medical Officer, Professor Paul Kelly, provided an update on the spread of Omicron variant. Omicron case numbers continue to increase in Australia and globally. Omicron continues to show greater ineffectivity than the Delta variant, but with less severity. So these are the updates, and since the beginning of the pandemic, there have been 612,106 confirmed cases, and Australia, sadly, 2,289 people have died. More than 56 million tests have been undertaken, with 1,643,000 tests reported in the past 7 days only. So that's a lot of tests. Globally, there have been over 294 million cases and sadly over 5.4 million deaths, with 2.6 million new cases and 7,169 deaths reported in the last 24 hours. The COVID-19 pandemic continues to surge in many countries around the world. National Cabinet received a detailed update on Australia's COVID-19 vaccination program from Lieutenant General John Freeman, Coordinator General of Operation COVID Shield. So here's some of the updates that have been brought to us. Australia's COVID-19 vaccine rollout and continues to expand, and to date 43 million doses of COVID-19 vaccine have been administered in Australia, including 212,497 in the previous 24 hours. In the previous 7 days, more than 554,500 vaccines have been administered in Australia. More than 94.5% of Australian population aged 16 and over have now received the first dose of COVID-19 vaccine, including 98.7% of Australians aged 50 years of age and over, and more than 99% of Australians aged 70 years of age and over. So these updates, as they come, and as I said before, we might be joining a Prime Minister very soon. More than 91.6% of Australians aged 16 years and over are now fully vaccinated, including 96.8% of the Australians aged 50 years of age and over, and more than 99% of Australians aged 70 years of age and over. And when we look at the booster ones, so there's about 2.7 million booster doses have been administered. Australia has sufficient supplies of boosters with nearly 18 million mRNA vaccines in stock in Australia. So there you are, up to date on the news this morning, and here's the announcement from the Prime Minister.
Tests for close contacts and those who are symptomatic, they are free. They have always been free. They are the essential tests that are required for public health management. These are the tests that are recommended by the medical expert panel, the AHPPC. Those are the tests that they say must be done. And so if you are a close contact, as recently redefined, if you are symptomatic, then you need to go get a test from the testing clinic. If you are not a close contact, if you are not symptomatic, you do not need to get a test. That is the advice that we have. And so we need to ensure that we are focusing those testing resources on the essential tests that are required, not the casual tests. I'll come back to those issues in a moment. We also agreed today to remove the requirement for a PCR test to confirm a positive rapid antigen test result. So if you've gone along, if you're a close contact and you've had a rapid antigen test and it's positive, you do not need to get a PCR test to confirm that. That will take pressure off PCR testing lines. Next, there would be a 7-day rolling test that is required for truck drivers. That will be removed. Pre-arrival tests for treatment at hospitals. Now, the good news is that at public hospitals this is largely not required, likely at all public hospitals. Some of those rules have been changed more recently, but we wanted to ensure that that was standardised. So if you're going into a hospital as a patient for treatment, and we're going to work with the private hospital sector that the same is happening there, that you will not be required to get a COVID test in order to enter the hospital to receive treatment. You will likely be given one when you're there, but you don't need to go and line up in these queues because you're going to get hospital treatment. And we discourage that requirement for people to have tests before receiving even private treatment, even in a GP surgery, where a person is not symptomatic and is not a close contact. No requirement for a second test post-arrival for those who are returning or arriving from overseas. They will have, as we said last week, a rapid antigen test on arrival. If that is negative, then they will not be required to have a further test. Remembering that 99% of those who are turning up at our airports are double vaccinated, and we are not seeing large number of cases come through international arrivals. Cases are community transmission. That's where the greatest risks are. And so there will no longer be that requirement for a second test other than in Queensland, and where Queensland say they will still insist on that until we get to a position of 90% double vaccinated in that state, and that will be done by the Queensland government. All states are moving away from requiring a rapid antigen test for interstate travel. Now, this doesn't apply to WA. WA were not in attendance at the meeting today. They are in a very different situation to the rest of the country. The rest of the country now have case numbers that are on the trajectory of rapid escalation, just like we've seen in New South Wales and Victoria, and they're reporting the same limited impacts on their ICUs and on their ventilator requirements in those jurisdictions.
And as mentioned before, we'll join with the Prime Minister live now.
Virtually. Japan is our only special strategic partner. This is one of the next level is an ally. So this is one of our most important partners. They're our only special strategic partner that is above a comprehensive strategic partnership. And the landmark treaty that we will commit to today, the Reciprocal Access Agreement, as it is known, will usher in a new chapter in advanced defence cooperation between Australia and Japan to deal with a new and even more challenging environment, particularly within the Indo-Pacific. This will be Japan's only reciprocal status of forces agreement in the world. And that says something very significant about the level of trust and partnership, a partnership of equals, standing up for the security of the Indo-Pacific and the values as democracies that we hold very dear, and the partnerships we have with so many countries in the region, particularly throughout ASEAN, for whom Japan is also a very important partner with ASEAN, as indeed Australia is. I've been working on this agreement together with Defence Ministers now and the Foreign Minister for over 3 years. When Prime Minister Abe first came to Australia in Darwin many years ago, I picked up those discussions from my predecessors and have worked through this now through 3 Prime Ministers in Japan, and I want to thank not only Prime Minister Kishida, of course, for bringing us to where we are today, but Prime Minister Suga, and Prime Minister Abe, with whom I had a very good relationship with both of those Prime Ministers. And for our first discussion in Glasgow, well, we are in exactly the same space. So I'm very much looking forward to my discussion with Prime Minister Kishida later today. This complements the suite of defence, security and partnership agreements that our government has been building over the last 3 years to keep Australians safe and to keep our region secure. We have concluded, as you know, the AUKUS agreement. We've concluded the Comprehensive Strategic Partnership with ASEAN. We were the first country in the world to have a comprehensive strategic partnership with the nations of ASEAN. The India Comprehensive Strategic Partnership and related security and intelligence agreements. And of course, with President Moon here most recently concluding the Comprehensive Strategic Partnership with Korea. This meshes together, it weaves together this suite of agreements with the Quad and Five Eyes already there at the start to ensure that Australia works with our partners to ensure that our region can be prosperous, can be safe and can be open and can be free. It backs in also in most recent history when we were able to participate in Exercise Malabar, which was a defence exercise that we had been absent from for around about a decade. And so this is just further evidence of how our approach to securing peace and stability in the Indo-Pacific region, keeping Australians safe, and the web of partnerships that we've been building is contributing to that objective. The second point, yesterday was a record booster day. Some 222,565 boosters were given yesterday. Now, to put that in context, that is more doses of a booster that has been given in one day than was achieved on first dose in any one day or second dose on any one day. So the booster program is up and running. It was a topic of further discussion yesterday, as I said in my press conference yesterday afternoon, with premiers and chief ministers, and as those state hubs continually come online, the full Commonwealth distribution system is up and running and in place. and has been for some time through our GPs and pharmacies. Both those GPs and pharmacies are doing an excellent job, and as you know, we made some changes to the payment arrangements for both GPs and pharmacists to support that over this summer period. And I want to thank those GPs and pharmacists who are out there giving people their jabs over this summer period. And particular as we go into next week, because the 5 to 11s vaccine program, that starts next Monday, and we're all on track for that. Those vaccines are being rolled out and distributed across the network over the course of this week. That will continue up until the day that those vaccine programs commence next week. Now, I want to stress again that the decision made by the TGA and ATAGI were essential before commencing that program. As a parent, there's no way, my kids are older than that now, they've already had their vaccinations under the 12 to 15-year-olds. But parents want to know that the vaccines that their children are being given are safe and have had the best regulatory expert panel in the world looking over it to give them that assurance. As a parent, I wanted it when I had Abby and Lillian go and get their vaccinations. And I would ensure the Treasurer, who's both of his kids are in that age group, that he will want the same as all parents of children of that age will want. And so that is very important, that we had that in place first. And that is in place, and that program will begin next week. And that enables the program that we have to have schools come back, stay back, day one, term one. That is what we agreed yesterday as Premiers, Chief Ministers and I. That is our target, that is our objective. Many states are already well advanced in their plans for achieving that. I know New South Wales in particular is, and Victoria, and I have no doubt the other states are moving quickly. And they'll put their plans on the table now, and we'll seek to harmonise those. And I'm looking forward to that report coming forward from Secretary Gaetjens next week. And hopefully we'll be able to conclude it soon after that, because getting kids back to school is very important, and getting their vaccination from next week is very important. So on the back to school list, on the fridge, get the pens and the pencils and the staplers or whatever you need, but on there says get vaccinated. So after you've been off to the other retail outlets, make sure you pop into the pharmacy or the GP and you get that vaccination for your kids. Now, finally, on the issue of Mr Djokovic, rules are rules, and there are no special cases. Rules are rules. It's what I said to you yesterday. That's the policy of the government, and has been our government's strong border protection policies, and particularly in relation to the pandemic, that has ensured that Australia has one of the lowest death rates from COVID anywhere in the world. We were one of the first countries to move on shutting our borders. We were criticised at the time, but it was the right decision, and we have maintained those important border controls over the entire period of the pandemic. We have tightened them even further on occasion. Again, we were criticised for doing that, but it was the right decision, and we will continue to make the right decisions when it comes to securing Australia's borders in relation to this pandemic. Now, our government has strong form when it comes to securing our borders. I don't think anybody doubts that, and they know that I, both as Prime Minister, Treasurer and particularly as Minister of Immigration and Border Protection, have a very strong view on this. And I want to thank the Australian Border Force officers for doing their job, implementing the government's policy. And the ABF has done their job. Entry with a visa requires double vaccination or a medical exemption. I'm advised that such an exemption was not in place, and as a result, he is subject to the same rule as anyone else. I also want to stress that ultimately this is the responsibility of the traveller. It is for the traveller to be able to assert and back up their ability to come into the country consistent with our laws. So they'll take advice from many places. No advice was provided by the Commonwealth Government, I underscore, but they will take advice, but it's up to them at the end of the day. And if they don't comply with the rules, then the Australian Border Force will do their job, and they have done their job. This is nothing about any one individual. It is simply a matter of following the rules. And so those processes will take their course over the next few hours, and that event will play out as it should. happy to take questions.
Prime Minister, can you just explain to us, first of all, the logistics of this at a federal level? Novak Djokovic was able to get on a plane, which means that he had a visa. Yeah. And he had to have this exemption, as I understand it, registered with Services Australia. Can you just explain to us how it was that he was able to actually travel here, and does that mean that these bits of paperwork aren't actually processed before somebody boards a plane?
No. The way it works is this. People try to run the border all the time, by the way. You know, people come with a visa but may not satisfy other requirements for entry. And people are put on planes and turned back all the time. Anybody who's watched the Border Patrol shows will understand that. This is not an irregular thing to happen if someone is put on a plane and told to return to their country, even if they may have come with a valid visa. A visa is one issue, but you have to have a double vaccination, because that's the country's rule for entry into the country, and that is assessed at the border. And we don't have Border Force officers in every airport around the country. And he provided information to the airline to allow his entry onto the plane. But people get on that plane. That is not an assurance that they'll be able to come through Australia's border at the other side. It wasn't a problem necessarily with the visa. There are many visas granted. And if you have a visa and you're double vaccinated, well, you're very, very welcome to come. And I think what this says to everybody in Australia, people are welcome in Australia. But if you're not double vaccinated and you're not an Australian resident or citizen, well, you can't come. And many countries have those rules around the world, and we have them, and they've been very important for securing Australia during the course of this pandemic. And so it is on them to have the proof to show why they wouldn't have to be vaccinated. Now, he was unable to furnish that proof to the Border Force officers at the airport last night, and they're the rules, and it happens on many occasions, and that's what's now happened.
Explain then the argy-bargy at the airport, which seemed to be about sort of a group visas that have been processed somehow, and this suggestion from the federal officers to the Victorian bureaucrats that it could be a get-around if Victoria was prepared to sponsor an individual visa application from the tennis player.
No, I mean, the Border Force has already rejected that scuttlebutt, as I understand it. There was no inquiries being made about support for a visa application, I'm advised. There was inquiries being made about whether quarantine was going to be waived. And to my knowledge, I still don't know whether the Victorian government were proposing to waive quarantine. I'm not making any comment on that. And that wasn't the basis of any decisions taken. And in relation to any advice he may have received from Tennis Australia, well, releasing the letter, I mean, the letter makes very clear that it was written back to Tennis Australia in November. And I'll read it out to you. People must be fully vaccinated as defined by the ATAGI to gain quarantine-free entry into Australia. This means that people who do not meet the ATAGI definition of fully vaccinated will not be approved for quarantine-free entry, regardless of whether they have received foreign vaccine exemptions. In relation to the specific questions that were raised by Tennis Australia, this is from the Minister for Health, I can confirm that people who contracted COVID-19 within the past 6 months and seek to enter Australia from overseas and have not received 2 doses of a TGA-approved or TGA-recognised vaccine are not considered fully vaccinated. Now, that was the clear advice given by the Minister for Health to Tennis Australia, and that letter is dated at the end of November of last year. So this is what I make the point to travellers. Whatever people might tell you, what matters is what you are responsible for when you arrive at the border.
Received any contact from the Serbian president on this matter. Is Mr Djokovic in immigration detention? And just if I may, on the question of rat supply, you said yesterday that that was a matter for the states to have secured that supply, and the federal government had fulfilled its responsibilities in securing those supplies. So can you explain to us, if the federal government knew that it needed to secure rat supplies, why didn't the state governments know that it needed to secure rat supplies, given we're supposed to have a national framework for our approach to the pandemic?
Well, they did know. It was discussed at National Cabinet in November, which I've told you from this platform before. I mean, it's the same rules that apply for PCR tests. States secure the supplies for PCR tests and for RAT tests that they would be rapid antigen tests that they'd be supplying for their own purposes in whatever state has always been a matter for the states. So there was no confusion. It was discussed in November. I'm not making any criticism of states. I mean, I'm just saying, you asked me whether the Commonwealth had done what it needed to do, and I said yes we had. And now we're going further than that in providing those 10 million further doses directly to the states to assist them over this period. And we will, as I said yesterday, face some shortages for a few more weeks yet, but both in the private supply as well as the government supply, contracted both by the federal government, which is now another 70 million in total, and with the state orders, that's up over 200 million over this month and next, or thereabouts. So those supplies will come, and this has been a challenge, but yesterday we got round the table and we sorted it out for what we could sort out yesterday, and there's more to sort out on a few more rules, and they're working on those. And one of the big ones, I would say, is ensuring we get this clarity around the return to school and the arrangements that will work around schools. And I thank all the premiers and chief ministers for their commitment to see kids go back and stay back on day one, term one. On the other issue, yes, no, I'm aware of representations that have been made by the embassy here in Canberra, and I understand those. But what my simple point is that all countries have their border rules. These rules are not imposed against any one country or any one individual. They are rules that apply to all those who enter. Other countries have those same rules, so there is no suggestion of any particular position in relation to Serbia. In fact, Serbia has been a very good friend of Australia and provided very strong support, particularly on security issues globally, and we greatly appreciate that. So this is a very specific case that deals with one individual, Australia's sovereign border laws and their fair application.
Without confirming positive rapid tests, how will Australia keep track of case numbers, or are they effectively redundant now? Also, would you consider rapid tests with a QR code so those results can be lodged?
Are now working on a process for reporting where they move to rapid antigen tests, which are being done at home. But as I said yesterday...
So we'll leave that there. So that was very timely, connecting in with the Prime Minister there with the live. So the key points there is that Novak Djokovic, did come in, and he did have a permit to come, and so that's how he came in. But upon arrival, it was discovered that he did not meet the health and safety requirements, and that is why he's been put in detention and what's happening. So, and with the rapid antigen tests, some concessions have been made, as we know that the concession card holders are now on the list to receive them.
The COVID testing regime is at breaking point. Seemingly endless lines for PCR tests, rapid antigen tests near impossible to find, and waiting days to get results.
We understand is incredibly frustrating and is highly disruptive, particularly to people's plans at this time of the year.
With the status quo unsustainable, National Cabinet has slashed testing requirements.
This is the product of Omicron and the different demands that are placed on the system because of Omicron.
You will no longer need to confirm a positive rapid test with another PCR test. Regular testing requirements for truck drivers have been dropped, and international arrivals will only need to get one test.
We need to ensure that we are focusing those testing resources on the essential tests that are required.
The severe shortage of rapid antigen tests, and at times their exorbitant prices, has prompted calls for free tests to be made available to anyone who wants them. That has not been adopted.
Universal free access to tests was not agreed by any of the states and territories today or the Commonwealth.
But there is financial support for vulnerable Australians to buy rapid antigen tests. Concession card holders will be able to get up to 10 free rapid antigen tests from pharmacies over the next 3 months.
I've spoken to the President of the Pharmacy Guild, and they are in agreement to provide that service.
There will be limits on how many rapid tests pharmacies and supermarkets can sell to prevent hoarding, although most retailers are doing that already, and a ban on buying the tests in Australia and selling them overseas. The changes point to the shift in mindset National Cabinet is trying to achieve, to no longer focus on the case numbers, but on those who are sick and need treatment.
So, no longer focusing on the case numbers, but let's take a look at the case numbers and see what's happening all the way around the country.
First things first, we have increasingly less of an idea about just how much coronavirus there is in Australia, and the accuracy of those daily case numbers are only going to get worse from here. We're now at the point nationally where 3 in 10 PCR tests or thereabouts are coming back positive. Through most of the pandemic, we've been dealing with numbers more like 3 in 1,000. So assume that all of the case numbers that you see from here going forward are a pretty big underestimate of the true virus prevalence. Just how big an underestimate, we really don't know at this point. One way of considering the prevalence of this virus in the community is by considering what share of the population have had a positive diagnosis in the recent history. And in Victoria, there are a handful of LGAs in which more than 2% of the population have tested positive in the past 28 days. Port Phillip Council leads that, Stonington as well, Melbourne. We've also got Yarra and Brimbank. The numbers are higher in Sydney. In fact, in Waverley, 6.6% of the population has tested positive in the last 4 weeks. We've also got Hunters Hill, we've got Sydney, we've got Byron and Woollahra, all with relatively large amounts of this virus floating around. And there's one age group in New South Wales that really stands out among the cases as well. In the state, more than 6% of people in their 20s have had a positive test result in the last 28 days. Remember, that does not include people who haven't had a PCR test. And given that young adults tend to have milder cases, are more likely to be asymptomatic, this could well be a relatively large underestimate. So as the virus speeds through this group of young adults and more people get boosted as well, that pool of susceptible young carriers is going to shrink fast. One thing that may well help this Omicron wave burn out is if it just becomes harder and harder and harder for the virus to find easy targets to infect.
So there you are, the facts and figures as they reckon. You can tell me anything, but you can't argue with the facts and figures. Well, right now, the other area is that the shortage of staff and getting staff. Many small businesses are struggling, and here's that report. And we know that, especially in the hospitality sector, this shortage is severe.
The cafe's sitting in stasis. There isn't really much we can do until it's time to open up again.
Will Priestley would usually serve hundreds of customers a day at his Hobart cafe over summer. But as the city experiences its first major COVID wave, he's made the costly decision to close.
Right off the top of my head, at least $6,000 or $7,000 this week. I'd say it's probably more, to be honest.
While 2 of his employees have been exposed to positive cases, they aren't considered official close contacts under the new national definition, which generally only includes people who've spent 4 hours in the same house as a confirmed case.
We really feel like we have a social responsibility being across from the hospital. We only have one major hospital in Hobart, so that being our major customer base, that would be an absolute disaster to pass that on to the staff.
Will is also worried about his own health after suffering a cardiac arrest a few years ago.
Once you start dividing the population number of Tasmania by the amount of cases, all of a sudden you're bound to see a couple of days. It certainly induces a lot of anxiety.
As the Omicron variant spreads, individual businesses have been left to make their own decisions about staff who've been exposed to COVID but have no symptoms.
It has been extraordinary. Just on a day-to-day basis, getting, 4 or 5 text messages from different staff members saying they're unable to work. And that's caused a huge dent in our workforce, up to 20 to 30% since Christmas. I haven't had enough staff to even serve the customers on the floor properly, let alone answer the increase of hundreds and hundreds of phone calls a day that we're getting as well.
At Catherine Bronga's pharmacy in southwest Sydney, demand for rapid antigen tests and COVID boosters is soaring. But like many, she doesn't have the staff to keep up. Some workers have been left waiting up to a week for pathology COVID test results before they can return to work.
We were seeing pharmacists who weren't getting their results for 7 days afterwards, right? And that's after their isolation period. So how do you then ensure that the pharmacist can get back and work?
For now, she's had to cancel the scheduled leave of staff who were desperate for a break.
We've actually had to bring back so many of our staff from annual leave. I myself was up at the coast, finally getting a bit of family time with my husband, who's also a doctor, and I've had to come back on several occasions from Christmas till now just to help out.
Catherine stocked up on rapid antigen tests for her staff, but she doesn't have any tests available to sell. Doesn't know any pharmacy that does.
Australia is behind in the use of rapid antigen tests. This is a real business continuity issue for many of these businesses, particularly in heavily affected sectors. And rapid antigen tests are one of the ways that they're able to keep the lights on at the moment.
Economist Andrew Charlton advised Labor Prime Minister Kevin Rudd during the global financial crisis. He's hopeful that life with COVID will soon become less stressful.
Omicron is affecting the Australian economy, but it's likely to be a speed bump, not a roadblock to our economic recovery. And it will probably do quite a lot less damage than Delta did.
Some economic trends indicate businesses may not be suffering as much as they did during previous outbreaks. After bouncing back from Delta lockdowns, restaurant bookings have come down from huge peaks during December, but are still up on 2019 levels, while mobility data follows a similar pattern, with trips by car, public transport and pedestrian traffic falling over recent days.
I don't believe that Omicron will derail Australia's strong economic recovery. Australia's experiencing a jobs boom right now, with nearly 500,000 jobs having been created since September.
We are out of lockdown, but our businesses are not out of struggle town.
Stephanie Miller runs a chain of skincare businesses in and around Melbourne. She's on the brink of closing one of the stores, though, where staff have tested positive or been close contacts.
So as with the Treasurer, that we are in the state where, the job growth has increased. Well, of course, there's less number of people coming in. Students are not coming in as well. So anyone who's out there has got a job, and other people are finding it hard to recruit other people. So that is just the reality of the situation. Well, right now, it's time to take a message from our sponsors.
GlobeNet Realty. GlobeNet Realty has been the longest established, trusted and respected agency in its trade area. Washa Chandra, Director of GlobeNet Realty, provides honest and ethical service to her customers. If you are thinking of investing in Brisbane real estate market, or if you are seeking professional property management, then you should contact Usha Chandra today on landline 3865 4466 or mobile 0419 775 416. And for further updates, log on to our website www.globenetralty.com.au. GlobeNet Realty is your own local real estate agency. Situated at Shop 52281 Sandgate Road, Boondall. GlobeNet Realty. Real estate is our world.
Real estate is the world, and don't forget that from next week we begin the real estate update series with Usha Chandra of GlobeNet Realty. Well, right now it's time to look at some of the functions and events. Now, just be mindful that some of the functions and events might get postponed or some even cancelled. So, if you are planning on attending any functions or events, please double check with the organizers. But here's what's been provided to us. Ladies and gentlemen, that's about all we have time for you in this segment. And don't forget that we go back to the normal segment and the normal timings from next week. Of course, it's getting in very close to the publication of the January issue. If you have any articles that you'd like to publish, now is the time. Otherwise, it would be too late. Hopefully all these functions and events that we just displayed there go ahead, and some of them might go ahead with restrictions. Well, restrictions are in place now, so if you are attending any of the functions and events, you would have to be mindful of what the restrictions are, what would be your conditions of entry and all those kind of things. And make sure that you always have your phone handy and charged, that you can display your COVID-19 certificate, vaccination certificates, and also perform the check-in via the Queensland Check-in app. So until tomorrow, it's goodbye from me. It's been wonderful having your company on the 6th day of January 2022. Right here in Brisbane, the temperature has now gone up to 28 degrees, and it's partly sunny, meaning partly cloudy. Until tomorrow, it's goodbye from me.